Welcome to our sciatic pain series. My name is Dr. Carl Baird. I'm owner of Evolve Performance Healthcare here in Portland, Oregon. And what we're going to be going over today in the next series of videos is what to do about sciatic pain. First and foremost, obviously we want to get you out of pain, but then also we want to teach you what you need to do to keep that pain from coming back. Again, a lot of times the people that are in our clinic, this isn't their first round of sciatic pain and they're super frustrated because it's one of those things that always seems to come back. And so even when they feel better, they're still worried that just the wrong movement is going to set it off again, and that keeps them from, again, really enjoying doing the things that they love. So before we get started, we got to understand a little bit more about what sciatic pain is. And again, it's a little bit of a misnomer. So when you hear the term sciatica or sciatic pain, you suspect that it's irritation of that sciatic nerve. But majority of the time, what it is a result of a disc herniation. And what that does is you can think of it like a jelly donut. So we have these intervertebral discs, which are between each of our vertebrae and our spine. And what can happen is too much force goes through one of those discs. It's like a jelly donut. It gets squished and the jelly pops out of one side, and then that jelly puts irritation on some nerves that run down the back of the leg. And so that's how you get the typical sciatic pain, where again, sometimes there's low back pain, but a lot of times it's pretty excruciating leg pain because we're irritating those nerves as they exit the spinal canal. So when we're talking about getting out of pain initially, one of the first things we have to do is pull that jelly back inside. We got to get that disc back where it needs to be so it stops irritating the nerve. So that's what we're going to cover in part one. The video today is a couple strategies that you can use to, again, just basically try to pull that disc back where it should be so it takes pressure off those nerves. So the first step that you want to do is take clues from the history. So a lot of times what you're going to notice is the pain worse sitting down? Is it worth standing up? What movements seem to aggravate the pain? And from there, we're going to get a lot of clues about what exercises are going to be best for you. Next, the second step is going to be to fix it's called the Antalgic Shift. So a lot of times, this isn't every case, but a lot of times what can happen is your body is going to shift away from pain. So what you'll see is your shoulder kind of shift to the right and your hips shift to the left, and it just feels kind of blocked. It feels stuck, and every time you try to kind of get that shoulder back up, it's either pretty excruciating pain or the shoulder comes back over to the right. You just can't hold that position. So before we do any therapies, the first thing that we have to do is try to fix that. It's called a lateral shift. So that's what we're going to cover in this video. I'll show you how we fix it here in the clinic and give you a couple idea what we're trying to do. So this is something that we're going to do against a wall. So I'm going to stand up here, and let's just say that again I'm kind of shifted to the right. So my hips are shifted to the left and I'm shifted to the right. Usually this means I'm avoiding pain down my left leg. So what I'm going to do is I'm going to come over to a wall. I'm going to stand you're not going to be able to see my feet, but I'm about 8-12 inches away from the wall. And again, I'm kind of shifted like this. From there, what I'm going to do is just lean into the wall. I'm going to keep my arm at 90 degrees. And again, for me, just because I have a little bit of a longer arm, I'm actually going to hunch my shoulders a bit, because what we're going to try to do is take my left hand and we're just going to press into my hips and drive my hips towards this wall. So it's a little bit of an overcorrection of this lateral shift. And you're just going to hold it for 1 to 2 seconds, and then you're going to relax. Again, you want to go back to neutral. You don't want to go all the way back to this shifted position. You're going to press, hold for a second or two, come back to what would be neutral, and then you're going to press again. And so again, this process, sometimes it's very easy. It just takes a few minutes. Other times, for a lot of people, it can take upwards of 15 minutes. So you're going to spend the time it takes for you to really stand up straight. So again, just back and forth like that. And a lot of times, now what you'll do is getting out of the position, you do have to be a little bit careful. You want to avoid what's called a rebound effect, where if I just stand upright, tall like this, it's gonna, again, can cause a little bit of pain and almost shift back, just kind of rebounds back into that position and can be pretty painful. So when you come up out of this position, again, just kind of make sure you're doing it very carefully and standing up. Another thing to keep in mind is this isn't always comfortable. So a lot of times when you do this position, you can get a lot more pain into the low back and sometimes even down the leg. But I want you to kind of push through that a little bit until we can get you again in that neutral position of how you would normally stand. And then from there, the next step would be to add a little bit of directional preference. For most people, it's going to be a little bit of extension, but that's something we'll cover in our sciatic pain part 2 video. The other antalgic shifts, again, that are a little less common, it's called fixed lordosis. So that's again in the low back. What can happen is I'm going to be in this kind of extended position here and I'm not going to be able to get out of it. If that's the case, we're going to add in a little bit of just flexion therapy, bending forward, easy enough. And then what can also happen is you can have a fixed kyphosis, which is again just the opposite. So now we're kind of rounded, pelvis tucked under like that, and you can't get out of this position. And if that's the case, what we need to do is add in a little bit of extension therapy. So there you have it. That is part 1 of our sciatic series. Just a little bit deeper understanding of what sciatic pain is and how to fix what is called an antalgic shift. So if you're enjoying this video, make sure that you again watch part 2 where we're going to cover the next step. And again, if you have any questions, you're in Portland, Oregon, you have any questions, about your specific case, your sciatic case, go ahead and follow the link in the bio and we'd be happy to help. All right, so go ahead, we'll see you in part 2. Thanks for watching.